Hi, my name is Sandy Martinez, and I am the Child Advocacy Center Director and Forensic Interview Director for Valencia Shelter Services. ACES stands for Adverse Childhood Experiences Score. This was a public health study done. It actually started in a obesity clinic. Um, the ACEs are a series of 10 questions, and each one addresses a childhood trauma, a different childhood trauma that one might experiences in their childhood. The different areas of trauma are emotional, sexual, physical, substance abuse, parental separation, or an absent parent, witness to domestic violence, family member incarcerated, and mental health issues in the family. The study measured mostly household dysfunctions. The study did not address trauma outside of the home, such as bullying or maybe a traumatic car accident or something like that. It mostly addressed households dysfunctions because that is the most common type of trauma that was reported by the study group. And so an ACE score is meant as a guide. Other traumas can increase the likelihood of health issues down the road. So the ACE score uncovered a link between childhood trauma and health issues in adulthood. So the more trauma you have as a child, the more increased health issues you have as an adult, and the less life expectancy that you have. So, for example, heart disease, lung disease, diabetes, high cholesterol, things like that. Also, it can increase health issues, mental health issues, such as depression, anxiety, PTSD, and things like that. So the study did show that childhood trauma is common in any type of race, gender, social and economic status. It's not more in one than the other. And the more types of trauma that one endures as a child increases the risk of physical, social, and emotional problems into adulthood. And so when a person experiences a childhood trauma in their childhood, they usually experience more than one type of trauma. So a person wouldn't just, usually, most of the time, doesn't just experience sexual abuse or just verbal abuse or emotional abuse. There's usually more than one type of trauma experienced by that person. So in the ACE score, you do get 1 point per question that you answer yes to, which is a type of trauma. And the higher the score, the higher the risk of health issues. So what causes this is the question. When a child is overloaded with stress hormones, they are constantly in trauma mode, which is it's fight, flight, or freeze. They can't learn in school when they're in this mode. They can't have healthy relationships when they're in this mode. They can't trust people in this mode. They develop long-term mental health issues, depression, anxiety, shame, guilt, inability to cope, inability to focus. So in turn, eventually they may turn to substance abuse or eating disorders or activities that escape their problems, such as multiple sex partners, high risk sports, or they may become a workaholic and overwork themselves. And then these behaviors eventually then lead into more serious consequences, such as if they turn to smoking cigarettes, they may develop lung cancer or COPD. If they are overeating, they may develop, diabetes or high cholesterol. And research also shows chronic stress can lead to bodily systems producing an inflammatory response, and that also can lead into other chronic diseases. So that's the link between the trauma. So it causes the stress, which then causes the activities to lead into those consequences and those health issues. And often toxic stress is passed down from generation to generation. So a lot of times this type of trauma is generational, and we call that the river of cruelty. And so, fortunately, you can escape the river of cruelty through, resiliency and therapy and coping mechanisms, and also what we call enlightened witnesses, which are people who um, are the reverse of trauma. They are support systems. They are people who are there for you, who care for you. And so the damage can be reduced.
Hello, my name is Catalina Nunez. I'm a licensed clinical social worker. I am also the clinical director at Valencia Shelter Services. I have been doing trauma work for about the last 5 years in different populations, being in prison, in jail, out in the community, and in actually psych hospitals also. So I have quite a bit of experience. And so, in working with people that have had trauma in their childhood, I have seen ACE scores from 0 to 10, just depending on what they've experienced. I have seen some clients who have had some low ACE scores, about 3, 4, who have been incarcerated um, due to what they've been through. But then I've also seen other clients, people who have high ACE scores being from 7 to 10, who have actually overcome all those adversities and have done something with themselves, as far as they had somebody to mentor them, be their support, be, be there for them to help them get through whatever they've been through in their childhood. So these ACE scores, yes, it is something to look at as far as what you've been through, what you could be through, what your children could have been through, but it's something that can be overcome depending on your support system, your um, coping skills. What do you use? What is your resilience to get through what you've been through? So, ACEs is a really good indicator, but it can be overcome.